In this video, I'm going to show you how to quickly and easily locate the main term when you are looking up a diagnosis code in ICD-10-CM. Hey everyone, I'm Victoria. I'm a medical coder, author, educator, and content creator, and on my channel I provide tips, tricks, and tutorials to help you be successful in a medical coding career. If you haven't already, I highly encourage you to subscribe, hit that notification bell so that you can get alerts when I post new episodes. We're going to be looking at some different examples of medical diagnoses and piecing apart how we can find that main term, that word that we're going to look up in the alphabetic index in ICD-10-CM. This is an important skill if you're working with medical codes or if you just want to learn a little bit more about them. So without further ado, let's get into it. Now, the first example I'm going to show is the diagnosis of back pain. So back pain. Oftentimes when we're looking for the main term, we're not going to look for a body area. We're not going to look for an organ system. We're not going to look for a location. So we're going to try to figure out what is the description of that problem. So pain is describing what is going on with the back. So we're going to look at that term pain. But let me show you actually first off what's going to happen if we were to look up the other term, if we were to look up back instead, because this is an important concept to understand. So if we go to P for pain, we can easily locate by following down on our next indentation where the term is for back. So here is pain back, M54.9, but what happens when we look up that term back? So if we were to look up back in the alphabetic index, it's going to say back, C condition, and you'll see that for just about any anatomic location that you're going to look up. And a lot of people get confused. They think that that means we're supposed to go under the term condition, that we're supposed to look under the word condition. But that actually doesn't mean to look up the word condition. It means see the condition of the back. What's the condition of the back? It's in pain. So that directs us that we're supposed to be looking up that pain. So you might see that for things like if you are having a wrist fracture. So if you're looking up wrist fracture, you should be looking up the term fracture. If you look up the term wrist, it's likely going to tell you to see condition. What's the condition of the wrist? It's fractured. That's the term you should be looking up. So if you look here under condition in the alphabetic index, it just says see also disease, but this patient doesn't have a disease of their back. They just have back pain. That's why it's telling us to see the condition of the back, which is that the back is in pain. So here we have an encounter for annual examination. For some of these, you should look up the word encounter, but actually for this one, it kind of tells you under encounter examination to just look under examination. So that's going to be the term we're going to look at. Examination would be our main term. Now, annual is kind of describing the examination. Encounter, might take us to the same place. And in some cases, some of those encounter codes would be, some of those encounter diagnoses would be the main term. So if we're doing maybe an encounter for genetic testing or for a sports physical, we could find those under the encounter as well. But in this case, we're going to look under the examination. And actually right here is where we will find it. The Z00.00 is the encounter for the annual examination. And you can also find it under here, encounter physical adult, see also examination medical, Z00.00. And here it is again. So sometimes ICD-10-CM is kind of kind to you, and there can be more than one way to skin a cat. Not always, but sometimes. Now if we go to our next example is colon cancer. So we said not to look up locations, right? So a colon would be an anatomical location. We're going to look up cancer. But the key here is, what is a cancer? It's a neoplasm. So are we going to look up the word cancer, or are we going to go to our neoplasm table? We're going to go to our neoplasm table, which is usually in most editions right after the alphabetic index, you have your neoplasm table. If you're not familiar with your table of neoplasms in ICD-10-CM, I do have a whole video that you can check out on how to use the table of neoplasms. So here we are just going to look under a malignant primary for the colon, which would be, let's see, coccyx colon. So here we would go to neoplasm table and we would look for the word colon, see also neoplasm intestine large, C18.9. Now in this example, we have postoperative pain. So postoperative is describing the type of pain that the patient's having. Now, oftentimes these kind of adjectives or descriptive words are not the main term. What is this describing? Well, it's describing the pain. So the pain should be that main term that we're going to look up. We've already kind of looked up a pain example, so I won't do this one. But let's move over to this long one here. We have an open type fracture, type 1 of the head of the left femur. So we're not going to look up locations again, right? So we're not going to look up left femur. We're not going to look up the head of the left femur. Type 1, again, that's describing something. What is it describing? It's describing this fracture. And then open type, also describing the fracture. So out of all of this, it looks like a lot to kind of absorb, but really the fracture is really what's being described by the rest of these terms. So that would be our main term that we're going to look up. And then we would go follow our indentations to, you know, the femur, the left femur, the head of head, the open type. So actually, let's kind of take a look at it. You know, there are so many bones in the body that you could potentially break that you can imagine there's a lot of different fracture codes. So let's see, here we have fracture femur, and look, it even goes on to the next page if we kind of go through over here. There's a lot of different fracture codes of the femur. So we have femur, this one was the head of the left femur. Let's see here, fracture femur. And under head, it says see fracture femur upper end head. So femur, upper end, and then head. So this would be kind of the area that we're in here, and we would have to double check here. You see this little green check mark? That means we need some additional characters. So we would have to further find out what additional characters we need for that. But again, today we're just going over main terms, how to find out what that main term is. Acute kidney failure. So acute is describing the type of failure. Kidney is describing that location of the failure. So the word that we're going to look up, failure. Type 2 diabetes mellitus with retinopathy. So usually when you see a combination code with diabetes, the first thing you're going to look up is that diabetes word. So type 2 is describing the type of diabetes. That it has the addition of retinopathy is kind of describing the diabetes. It's further specifying that diabetes. Interesting thing about diabetes coding, though, and I want to show you this in the book, is that there is a guideline actually in ICD-10-CM that anything that comes under this term with, under diabetes, has an assumed cause and effect relationship. And that's in your guidelines. It says that basically anything that comes under that term with in the alphabetic index, including diabetes, is assumed to be cause and effect. It's assumed to be related. You would code it as related unless this provider specifically states that they are not related. So let's say the provider says, you know, diagnosis 1 is type 2 diabetes. Diagnosis number 2 is a foot ulcer, right? So instead of coding one code for, you know, our unspecified diabetes and then another code for a foot ulcer, we're going to use this combination code instead, the E11.621. Now you're going to need to further specify the type of foot ulcer, like if it's a right foot ulcer or left foot ulcer. So if you look up that code, it's actually going to tell you to also attach an L code to let them know the further specifications about that foot ulcer. This one's a little bit tricky. So feeding problems with newborn. So what are we kind of describing here? What's a problem? The feeding's a problem. Is it the newborn? Is that kind of like the you know, that's, I don't want to say that that's like a disorder. A newborn wouldn't be a disorder. It's more so the feeding problem. The feeding is describing the type of problem. It's a feeding problem with a newborn. That's also kind of describing what the problem is. You know, it seems kind of funny, but that's actually the word that we're going to be looking up. That's our main term, is problem. And if we look here under problem, we can find here, where is my problem? There we go, problem. And we have here, let's see if we can find feeding in our next indentation. I think it's a little far down. Here we go, feeding. And then we have newborn. So that will direct us to our code. So we always have to make sure we follow our indentations, that we have some of these books, the yellow guidelines, to help us out and see that we are at feeding here, and that's still under our problem feeding. And then our next indentation is the newborn. Elevated blood pressure reading. So this is important because there's a difference between having one isolated elevated blood pressure versus being formally diagnosed with hypertension. The fact that a patient had one elevated blood pressure doesn't always mean that they have hypertension. In order for it to be hypertension, the provider has to document that they are diagnosing that patient with hypertension. If they just have an elevated blood pressure reading, okay, so let's kind of look at this again. You know, what are we describing here? We have a blood pressure, we have a reading of the blood pressure, but what was wrong with it? It was elevated. So the elevated is the term that we're going to look up. So here we have our elevated blood pressure reading, so isolated. And there's no diagnosis of hypertension, so that's different than our straight hypertension code when it's just that elevated reading, that isolated elevated reading. And then we have acute myocardial infarction. So myocardial is the location, that's the muscles of the heart, right? So what's wrong with it? It's having an infarction. The acute is describing the infarction. The myocardial is describing the type of infarction. So we're going to look up that term infarction. And then here we have stage 3 pressure ulcer of the buttocks. Buttocks is the location. So we said a lot of those locations, those anatomical locations, we don't look up. So what's going on with the buttocks? Like if we were to look at this up, it would say C condition probably, right? So what's the condition of it? Well, there is an ulcer. It's a specifically type of ulcer. It's a pressure ulcer. It's a stage 3 pressure ulcer, but our main term here would be ulcer. So once we've got our main term, again, we would go to our ulcer codes. We would follow our next indentations down to pressure. And we have one here that is of the buttocks, or we could go to our stages. You see these different stages here, and this one was a stage 3, so stage 3, and then of the buttocks. And then again, that green check mark there means we're going to need some additional characters. So there you have it, some simple steps that you can use to help easily identify that main term of a diagnosis. With some practice, you will be able to breeze through these like a pro. And don't forget, if at first you don't succeed, there's other terms you can try to look up. And finally, don't forget that when it says C condition, that doesn't mean look up the word condition. It means what's the condition of that thing that you're looking up. So if you were to look up back pain and you looked up the term back, what's the condition of the back? It's in pain. If the patient had tingling in their fingers and you looked up the words fingers and it said C condition, what's the condition of the fingers? They're tingling. So let's try and look up the word tingling. I hope this video helped you out. If it did, you can also drop a super thanks to show your appreciation. I will see you guys in the next video. And until then, just keep on coding on.